African healthcare authorities or health department authorities are appealing to citizens to start disclosing possible cases of monkeypox virus or Mpox. The National Institute for Communicable Diseases has confirmed 2 cases at Addington and at St. Augustine hospitals in Durban. The first case was recorded last month also in Durban after a man with no travel history tested positive for the virus. Let's get what the health department is saying and the advice it's giving. Spokesperson Foster Mkhale joins us this afternoon. Foster, it's great to talk to you. Thanks very much indeed for coming on. Mpox is, of course, an infectious disease. It has the potential for all kinds of complications. Why this appeal now by the health department to citizens to be more open about whether they may in fact have Mpox?
Good afternoon to you and good afternoon to your listener, your viewers, and thanks for this opportunity. Yes, as the Department of Health, would like to appeal to all those who experience Mpox-like symptoms to go to the nearest health facility, including those who had direct contact with those who tested positive for Mpox, to openly disclose and present at the nearest health facility, either in public or private, so that we are able to diagnose. If they test positive, we will be able to put them on treatment. Of course, you know that there's a challenge of stigma. People don't want to come out because we've experienced this when we're conducting what we call contact tracing and case finding, even where the patient said, I was in contact with Foster or Michelle, but when they come to Foster, we don't cooperate with the health officials in order to determine whether I contracted the disease or not. So that's why we applauded all those who came forward and openly disclosed and interacted with our health officials. That's why one of them tested positive. So that's how we managed to confirm the additional 2 cases in the last 2 days. So we are saying to all those who had a direct contact with those who already tested positive, please try to work closely with the health officials to check if indeed you were also positive or not.
Certainly. I mean, is the sense that the health department is getting that there are definitely more cases of Mpox than we do have confirmed, Foster?
No, definitely, especially because none of these patients, they had international travel history to the countries which are currently experiencing the outbreak of Mpox. So that suggests that there's a local transmission around the country. So, and the only way we can try to spread or stop this local transmission is when those who experience symptoms of Mpox come forward, present themselves in order to protect themselves and also prevent further spreading of this infectious disease. So we are appealing to all those who experience this and also those who had a direct contact with the known patients to say, please come forward so that we want to determine the level of transmission of this infectious disease at community level.
Is it a case, do you think, of stigma and the stigma associated with Mpox that's causing people to not get tested by their local healthcare authorities, Foster? Or is it just a case of not having the requisite information at hand? Perhaps I'm not even sure that I need to get tested, and I'm not even sure that this might be an incredibly infectious disease that I have.
Yeah, no, the reason why we're saying stigma is because based on our case investigations and contact tracing. Contact tracing, it means we're trying to go to all those who were in contact with those who have, who have tested positive. But unfortunately, some of them, they were not open and honest to interact with us. So that's why it was very difficult. And some of them, they said because of stigma, so they don't want to be known that they had a direct contact person. They had a direct contact with those who tested positive. So stigma is one of those which deterring people from coming forward in order to test or to screen and test so that we are able to know whether they also tested positive or not.
Yeah, I mean, I've had discussions with a number of officials from the health department, particularly the Deputy Minister on more than 2 occasions around Mpox. But is this enough, Foster, this kind of discussion on this kind of platform, or is it now at the time where the health department needs to do more to roll out an awareness campaign?
No, we are doing more. In fact, we are doing more across the country now. As in fact, what I can even tell you that the numbers are increasing. So far, we are sitting with 4 confirmed cases. 3 of them, they were confirmed around Durban in KZN, 1 in Gauteng. But now we are sitting with the extra suspected cases. I'm saying suspected cases because we've interacted with some of the people who were in contact with the confirmed patients, and now we are waiting for the test from laboratory. So at any time, won't be surprised if the numbers they increase. So, and this is what exactly we're trying to prevent. Say, please, anyone who had a direct contact with this person, whether directly or indirectly, please go to your nearest health facility, or even if you experience the symptoms, but you are not sure whether you were in contact with one of those who tested positive, please go to your nearest health facility, because some of the symptoms of Mpox, they are not unique symptoms. They are symptoms which are associated with other health conditions like fever, headache, body pains. There are symptoms which are associated with conditions like influenza. As you know that currently the country is going through influenza season. So you may think that you are suffering from influenza, try to take influenza medication, but until you go to the nearest health facility, they diagnose you to tell you that indeed you are suffering from flu, then you will never know your health status.
I mean, according to the World Health Organization, there have been 3 Mpox-related deaths in 22 countries. That's as of March this year. So they're saying there's low-level transmission that's continuing across the world. I suppose that also tells us here in South Africa that we're not at the stage yet of any kind of vaccine campaign.
Yeah, no, definitely. Also, Ensa, I indicated that, and also the incubation period is from 5 to up to 21 days. So even if one visited the countries which are currently experiencing the outbreak of Mpox, then they managed to enter the country before the signs and symptoms were visible. So hence we say, whether you have traveled to countries which are currently experiencing the outbreak of Mpox or not, please, as long as you have got you experience suspected symptoms of Mpox, please go to your nearest health facility, because of course the mortality rate currently is low, but that doesn't mean we are immune from mortality. So we say we are trying by all means to prevent even a single death as a result of Mpox in the country. So
just a quick comment from you, Foster, on what I should be looking out for insofar as Mpox symptoms are concerned.
So in terms of symptoms, as I indicated, that there's the symptoms of Mpox that are not unique from the symptoms of other health conditions, but the most visible symptoms that you will see that you might, or you suspect that you might be having Mpox, is rash, is uncommon, thick rash, size of a blister, very painful, very itchy. Some of these symptoms, they include your fever, your headache, your body muscles, and so forth. As you know that these are also the symptoms of other health conditions. Hence we say, please don't diagnose yourself. Allow the health officials to diagnose you so that they can put you on the right treatment to treat the right health condition.
Yeah, and so that you can keep yourself and your community safe as well. Foster Mkhale, let me thank you for your time this afternoon, the spokesperson for the Health Department.